The most important thing when you're studying the test or you're trying to figure out what's going on, the lunate goes between the scaphoid, this ligament here between the scaphoid and the lunate, and then the lunate and the trapezium. So anytime you're trying to figure out which one it is, you just find that lunate and you could shimmy that lunate around, right? Or you'd go to the scaphoid next. So after you find the lunate, you'd go just a smidge over, like such a smidge over, right? So it kind of comes right off the ledge of that radius, and then your thumb, your other thumb on the volar side should sit right underneath, right? And basically the scaphoid sits, so you can find it that way. There's a couple ways you can find it. So you find it, and then all you have to do again is you take it and you shimmy it. So here, if you shimmy it, you'll feel it in your index finger. Push that bone into your thumb, right? That's your scaphoid. And another way to find your scaphoid is you find your first metacarpal. So you gotta go and you gotta feel that. Usually it slides down and then there's a little dip, a little drop, right? That drop is the end of that bone. And what you want to do is after that, you just move your thumb down, right? And you're going to be right on that scaphoid. The problem is you might not be able to feel it unless you go into radial deviation, which will make that scaphoid pop into your thumb. And then when you, ulnar deviation, yeah, I say it so convincingly, right? Yes. No, you know more than I know. It's okay. You can call me out. It's ulnar deviation. When you go into radial deviation, it's going to disappear, right? So that's how you can test it too, right? If you want to test and see, you'd go into ulnar deviation. You can push it. It's going to pop out into your thumb. You can actually push on it. And if that spot really hurts, there's a sharpness to ligament injuries that it's not the same as like muscle injury or like tendon injury, just like someone who's really painful. This is not going to work with everybody, because if you have people who are like, you touch them like, oh my God, then it's not going to work. It's not going to work to rule in and rule out. So you might have to reduce their sensory issues before you can actually go in to rule in ligament issues, okay? But at least you find out and you know where the scaphoid is, right? So if you know where the scaphoid is, then the trapezium is literally right on top of it. But it doesn't really, it really doesn't pop out as much as the scaphoid, because the scaphoid, even though I draw it like this, the scaphoid is actually really huge. And takes up a lot of space, right? So the trapezium is right under that first metacarpal. So if you go and you find that first metacarpal, it's actually quite hard to palpate it on the volar side because you have a lot of thenar muscle. So really what you're going off of is the dorsal side of that metacarpal, right? And you can take your finger, and if you shimmy that metacarpal, you can actually feel it. If you can see how much I'm moving, right? That's my metacarpal moving. That's just my metacarpal, and right underneath that is my trapezium. So you know your trapezium is there because that's the anatomy. So if you wanted to know if something is wrong with your trapezium, you just take that metacarpal and you go like this, like that. And then if it's painful, there's some arthritis, right? If it's really painful, there could be something wrong. So I think Cindy had a question on a trapezium fracture. I'm going to answer that right now since I'm going over the trapezium. So they are of course going to have a lot of thenar thumb issues because they had a trapezium avulsion. Now that's usually, it's quite rare, but a partial one. So something happened to the thumb that transmitted forces right here. So of course, if all the carpal ligaments are intact, it's really a ligament issue between the metacarpal and the trapezium. potentially, right? And even though he's 4 months out, he's swelling along the thenar eminence, which is normal because of location. And really one of the reasons why ligament issues or thumb issues are so long lasting is because really, if you think about it, you can't do anything without your thumb. Your thumb does 50% of the work of your hand, so it's very hard to like just not do anything with it at all. So they're constantly kind of irritating to a certain extent, and they're always going to they're going to have pain because they might be a little bit imbalance there, right?
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.